When I initially did the interview with Azeal, I never was able to get into what infantile spasms really are on a technical level. I was trying to condense 4 years of my own personal experience into a short and concise story, and I felt I was doing a disservice by not letting you all know the nitty-gritty of IS. So that being said, I figure I could take this time to detail the finer points of this disease and raise awareness. It seems the overwhelming majority of you wanted this to be my next video topic anyway. So, what is IS exactly? Infantile spasms, previously referred to as West syndrome, first described by Dr. William James West in the 1840s, is a rare form of catastrophic epilepsy found only in infants and young toddlers, with the peak incidence between 4 to 7 months of age. The estimated prevalence is 1 in 2,000 to 6,000 live births. Throughout the entirety of this video, I will be referring to infantile spasms as IS for the sake of expediency. The Epilepsy Foundation describes the seizures may appear to be subtle and could be confused with other normal baby behaviors or colic. IS can appear in different ways. Sometimes they may be called flexor spasms, myoclonic jerks, or jackknife seizures due to their appearance. The spasms consist of a sudden stiffening, often the arms fling out as the knees pull up and the body bends forward. Less often, the head can be thrown back as the body and legs stiffen in a straight out position. Movements can be more subtle and limited to the neck or other body parts. Infants may cry during or after the seizure. Each seizure lasts only a second or two, but they usually occur close together in a series. Sometimes the spasms are mistaken for colic, but the cramps of colic do not occur in a series. They happen most often after just waking up, but they seldomly occur during sleep. Babies with infantile spasms often seem to stop developing as expected, or they may lose skills like sitting, rolling over, or babbling. Often babies lose interest in their surroundings. They may interact less socially too. It was Dr. William James West's very own biological son's experience dealing with this form of epilepsy where the diagnosis of West syndrome originates from. It was a heartbreaking letter to The Lancet entitled "On a Peculiar Form of Infantile Convulsions" that Dr. West recounts his experience with his son, sharing his observations as the disease progressed. Never appearing to go beyond the mental capacity of a 2-year-old, Dr. West's son passed away at the age of 20. The epileptic treatments available for epilepsy in the 1800s are a far cry from what we have available today. Things such as leeches, calomel, phlogiston, opium, and even hot baths were used to treat epilepsy. From then, we have a much better understanding of what causes IS. According to the Epilepsy Foundation, 2 out of 3 babies with IS have some known cause for the seizures. However, the range of causes can be broad. The most common cause is a structural change in the brain. This may be due to a prior injury, such as brain infection or lack of oxygen to the brain. It can also be due to a change in the way that the brain was developed during uteral, such as cortical malformation or dysplastic tissue. Genetic causes are also possible, as there are a number of genes associated with spasms. Metabolic causes can also lead to changes in brain function and can cause spasms. Other babies have no apparent injury and have been developing normally. There is no evidence that family history, the baby's sex, or factors such as immunizations are related to infantile spasms. 33% of all infantile spasm diagnoses are classified as idiopathic, meaning there is no known cause for the epilepsy. There is a very significant importance to getting a diagnosis as soon as possible. First of which, the speed of the treatment is tied directly to prognosis. The longer infantile spasms remains unchecked, the possibility of mental handicaps or even life-threatening epileptic brain damage is to occur. It's also important to remember that IS is actually quite rare. In my own personal account, the hospital that is near to us had never even heard of a disease called West syndrome. Statistically speaking, a pediatrician can expect to have a patient with IS only once within their entire healthcare career, if they are quote-unquote lucky. Even with babies exhibiting similar characteristics of IS, the rarity of the disease means most likely IS is actually not the cause. That is why an official diagnosis is so important. To do this, a careful history of spells, including what they look like and how often they occur, need to be given to your doctor. Much like from our experience at the time, do not be afraid to get second opinions, especially if certain non-invasive tests are not being offered to you or your access to them locally is limited. Make a video of the events and show them to your doctor if you are concerned your child may be having spasms. But an EEG is typically the only surefire way for a proper diagnosis because it looks at the electrical activity of the brain. An EEG in a baby with infantile spasms usually shows a pattern called hypsarrhythmia. When the seizures are not occurring, this high voltage spike and wave pattern is often helpful in confirming the diagnosis. From our own experience, our daughter had something called a modified hypsarrhythmia, which meant that the high voltage spike pattern wasn't occurring all the time. Not all infantile spasms are created equally. Some happen once in a while. Typically, they happen daily, and some might even need emergency intervention. That is why diagnosis is so important. After an official diagnosis, a number of tests need to be done to help determine cause. MRI, blood, urine tests, spinal taps, to see what treatment best fits your child's journey. At a bare minimum, that day, a doctor will often recommend starting some sort of anti-epileptic drug, which I will refer to as AEDs going forward. Unfortunately, even with the advancements in medical treatments from the 1840s, when it comes to drugs which are meant to stop epileptic activity, we actually still don't quite understand why one medication will work for one person and won't for another. Prednisolone and ACTH are often considered frontline medications for IS, but for us, prednisolone did nothing, and ACTH only made her epilepsy so much worse. Unfortunately, this is just how we currently deal with treating IS, 2-week courses of trial and error. While there is some research suggesting that cannabis derivatives, such as CBD, can be effective at treating epilepsy, more research needs to be done to get definitive results. As it stands, there are very few side effects when it comes to CBD, so with the recommendation of a specialist, it wouldn't hurt to ask about it. Certain AEDs interact with CBD, increasing their toxicity, which is why it's important to consult with your physician before simply going out on your own and trying it. The effects also seem to take longer. This is similar to the timeline of ketogenic diet therapies that will often be tried for a month to see any results. For us, as it was explained to us like a majority of IS cases, our daughter's cause was a physical malformation of the brain tissue rather than a chemical imbalance. As such, while medication could theoretically work for some time, eventually they will all fail, and surgical intervention is often the only recourse. But epilepsy surgeries will be a topic for another video, as we can dive deeply at how far we've come in surgical advancements in the year 2022. I hope this brief synopsis can help those of you who watched a better understanding of the severity of this horrible disease and bring awareness to others, some of which might be suffering in silence because someone simply didn't know any better. Please consider a donation to the Epilepsy Foundation, as the majority of this information was taken from their resources, which I'll be including a link to in the description box below. Until next time, this is IS Doge, signing off.